There we go. Hi, everyone. Thank you so much for having me, and thank you so much for putting this wonderful event together. It's great to be back here at Forecasting Healthy Futures, once again ahead of a COP where we're hoping we're going to see health a lot more prominently again this year. So thank you so much for inviting me. I'm going to go ahead and share my screen. And I'm going to tell you a bit about our findings on climate change and health, mostly from our latest Lancet Countdown report. The latest report was published last year. I'm going to try to tell you a bit of hints of what will come on this year. I cannot tell you much about it just yet because we're still preparing the report, but I'm hoping to give you a few hints. So, as you just heard, I'm the executive director for the Lancet Countdown on Health and Climate Change. And the Lancet Countdown is basically a very big research collaboration. We're a collaboration of over 300 researchers from around the world, and we bring together over 300 collaborating institutions. We work very closely with the WHO in this effort, as well as with meteorological organizations and leading universities around the world. And as you know, each year we publish these reports that get published in the Lancet ahead of the COP negotiations, with the purpose of providing the evidence that is necessary to inform a health-centered response to climate change. So our latest report, we published it last year before COP28, a COP where we saw health so prominently in the climate agenda. And since then, we have seen health prominently also in Bonn, just recently in the intersessionals, as well as climate change very prominently in the health agenda with the WHO's great leadership in this space. The main thing that we've seen in last year's report is that we're currently at about 1.1 degrees of global mean heating, and we're already seeing how climate change is claiming lives and livelihoods all around the world. The effects of climate change are being felt today and disproportionately affecting the most vulnerable communities in every country. So just to give you a bit of an idea of what this looks like, I won't walk you through every one of our indicators showing the growing impacts of climate change, but just giving you a few of the findings that we have in this sense. We're seeing that climate change is increasing mortality and morbidity related to heat exposure. Of course, we estimate about an 85% increase in heat-related mortality since the 90s alone. And through a counterfactual estimate, we estimate that this is more than twice the increase that we would have expected in constant temperature, so if temperatures hadn't increased. We're also seeing increased morbidity associated with the impacts of climate change. But one thing that I'm showing you here in the bar graph that you see in the middle of the screen is how the increased temperatures and exposure to heat is increasingly undermining people's capacity to work outside. We know that there's limits to the work that can be done in extreme heat exposure. People need to take more breaks, and the health of workers is put at risk when they have to work in extreme heat conditions. We estimate that heat exposure led to the loss of 42% more hours of potential labor in 2022 than in the 90s. And that accounted for a loss of around 863 billion US dollars in 22 alone, 863 billions. What we're also seeing is that as proportion of GDP, it is the low human development index countries that are disproportionately affected, with the agricultural sector, which you see there in red, being the most affected sector, obviously because workers are working outdoors exposed to the elements, and they constitute a big part of the local workforce. This not only means that those workers lose their income, which then has an effect on their well-being and on the socioeconomic conditions on which their good health depends, but it also affects the productivity in the agricultural sector, which is oftentimes linked to the local food security. So the implications of this labor capacity loss for health are many and multidimensional. We're also seeing an increase in extreme weather events, increased flood events, and increased drought events, which is what I'm showing you now on screen. We're seeing some areas of the world that today see more than a full year in extreme droughts, more than they would have in the 1950s. You see there, for example, the Horn of Africa and some of the most vulnerable areas of the world are seeing extreme drought. Some of them has already been attributed formally to climate change. So we know it's climate change behind it. And we estimate around 30% of the global land area is now affected with extreme drought, which wasn't in the 50s. So this obviously affecting our food security, our crop productivity, is affecting our water security, the water quality. It's also affecting sanitation, and as a result, the transmission of infectious diseases. Food security and undernutrition is growing as a result of climate change. We have data where we attribute the growth in food insecurity to extreme weather events like the increased frequency of heat waves and drought events. And we estimate that about 127 million more people experienced moderate or severe food insecurity in 2021, directly linked with the increased frequency of heat waves and drought. So we know it's climate change behind these effects. And then obviously the increased risk of transmission of deadly infectious diseases like dengue, like malaria. Also, vibriosis and other waterborne pathogens are increasing in their environmental suitability for transmission, which means that control efforts of these deadly diseases are becoming so much more difficult. We estimate that about 10% of the global land area has become newly suitable for the transmission of malaria. And as you can see in the graph there on the bottom right, those areas in yellow are the areas that have become newly suitable for transmission of malaria. So in the Northern Hemisphere, we're seeing malaria creeping up further to northern latitudes. New areas expected to start seeing local malaria transmission shortly. And the important thing to take into account is that I'm showing you here just a few examples, but climate change is affecting almost every one of the dimensions of health that we monitor: increased frequency of wildfires, as I said, other extreme weather events, food insecurity, increased morbidity, increased air pollution exposure, and exposure to air allergens. So this is starting to affect the foundations of physical and mental health also being heavily impacted by climate change, and it's starting to erode our health determinants. These impacts happened mostly at the same time. So many areas will not only be dealing with one of the hazards of climate change, but with many of these hazards in what we call multi-hit scenario, with cascading impacts that compound each other and that make the situation so much worse, adding on to other crises that we're already seeing. We've seen in the COVID-19 pandemic what those compound impacts look like. We're going in many parts of the world through a cost of living crisis, an energy crisis, food insecurity due to war, due to disruption of supply chains. So it acts as an impact amplifier. So with this, all these impacts happening at once, obviously the burden on our health systems is growing. And that's why adapting to climate change, strengthening our health systems, building resilience to the impacts of climate change is extremely urgent. And we're already lagging in building resilience to climate change. So when we look at this data and kind of some of our adaptation efforts, this is data that the WHO collects in their country survey, most of it. And what we're seeing is, as an example that I'm showing you here, the number of countries with climate-informed health early warning systems for key climate-related hazards. So airborne diseases, heat stress, mental and psychosocial health, and the extent to which these countries have adopted what could be potentially life-saving interventions as early warning systems can be, if, of course, if matched with early response systems. But what we see in every dimension of adaptation that we monitor is kind of the same thing. We're lagging in the adoption of adaptation measures. And the countries that are lagging the most are those with low Human Development Index countries. In each of those bar graphs that I'm showing you, you have the world disaggregated by Human Development Index group, and it's always the low Human Development Index countries that are lagging the most in their adoption of adaptation efforts. When we ask countries why that is, they report two key drivers. One is a scarcity of funding, and the other is a scarcity of technical support and knowledge. So there's a lot that we need to be doing as an international community, and particularly in terms of international funders, to address this and attach the WHO's project is essentially in building that capacity to adapt. But we're still lagging, and it means that the most vulnerable communities are most unprotected from climate change, and therefore we can expect global health inequities to widen as a result of the most vulnerable being most affected and left in an even more vulnerable situation. Aside from not adapting proactively, what we're also seeing is that there's some spontaneous adaptation that is already starting to happen. So when we look at heat exposure, a very effective measure to reduce exposure to extreme heat, and as a result, the morbidity and the mortality associated with extreme heat, has to do with increasing our urban green spaces, particularly as urban centers become very hot in the heat, due to what is known as the heat island effect, reflective surfaces that become really hot in urban centers. So increasing the coverage of green spaces, particularly with tree cover, can be very effective at offering local cooling, local shade, and lowering temperature in urban centers. The other advantage that green spaces have is obviously that they offer spaces for recreation. They offer safe spaces for children to recreate and to develop as they should, as healthy children. They also offer spaces for physical activity, and they have been shown to reduce overall mortality and morbidity as well. However, we're seeing that only about 30% of urban spaces globally are considered moderately green or above. And we're seeing that the coverage of green spaces is not growing. We're not increasing green space coverage significantly, at least not in the past 20 years. But what we are doing is increasing the use of active cooling measures like using air conditioning. We're seeing that the proportion of households with air conditioning units increased by 70%. 1/3 of all households globally now have air conditioning. And while air conditioning is very effective in offering local cooling, for some settings it's essential when the heat is extreme and the population is very vulnerable. It also is a very energy intensive measure of cooling. It increases the global greenhouse gas emissions associated with energy use. We estimate about a 73% increase in carbon dioxide emissions since the 2000s. It also increases air pollution related with this energy production. And it also generates heat around the outdoors. So the air conditioning units throw their waste heat from the inside to the outside, which means that the urban environment becomes increasingly hot. So the urban heat island effect worsens. And that means that the gap between those that can and cannot afford air conditioning widens. And also because of the increased demand in energy, it increases also the burden on our grids and the burden on the energy systems, exacerbating energy poverty as well, particularly during summer seasons. So because we're delayed in adaptation, we're turning to what we call kind of maladaptation efforts. And this is a missed opportunity for tackling the hazards of climate change through a health-centered and sustainable approach. But this is what we're seeing up until now. This is what's been happening to date. But we're currently at 1.1, 1.2 degrees of global mean decadal heating. And we're very rapidly shifting towards a future where current activities, currently implemented policies and actions will take us to about 3 degrees of heating. So we did estimates of what, even if we were to keep to the 2-degree target of the Paris Agreement, the upper threshold that we committed to limiting global mean temperature rise to within the Paris Agreement, what would our health indicators look like? And what we found is that even in a scenario in which we keep global mean temperatures to 2 degrees by the end of the century, already by the 1950s, we would see an enormous increase in every one of the indicators that we monitor. 370% increase in heat-related death of people over 65 years of age, 50% increase in labor capacity lost due to extreme heat exposure, with the associated losses in income and the economical deterioration and the socioeconomic conditions. Or more than 500 million more people becoming food insecure, and obviously infectious disease transmission growing. So if we have not been able to adapt to the world today, to heat today effectively, what would it take to adapt to a scenario of 2 degrees? And these figures look too large for us to be able to effectively adapt. So definitely we have to increase our adaptation efforts today to protect people today from the health impact that we're already seeing and that we will see inevitably in the future. But we have to do our utmost to limit temperature rise as close as possible to 1.5 degrees. And that is why we say urgent mitigation is an absolute health imperative. We need to keep temperatures down so that the hazards that people will be facing don't exceed the capacity of health systems to adapt. And therefore, Marina always says this, tackling greenhouse gases, climate change mitigation is primary prevention, is the most essential preventative measure. So when we look at what we're doing on that front, we're also not doing that well. So looking at the energy system is the biggest single contributor to greenhouse gas emissions. It's also a sector where we have the technology and the capacity to decarbonize really rapidly because renewable energies have become today more affordable than fossil fuel-based energies, and we have the technology. It just requires capital investment, but it pays off very quickly. And when we look at the energy system, we're seeing that the carbon intensity, that is the amount of carbon dioxide produced for each unit of energy that we produce, is growing. So our intensity of energy productivity, the carbon intensity is increasing about 0.9% in 2022, following the COVID-19 pandemic. And the total emissions have reached a record high last year and the year before, and the year before. So we're increasing our emissions rather than reducing them. And one thing that is interesting for you to look at is this bottom graph here. Renewable energy and the electricity generation from renewable energy is increasing really rapidly globally, as you can see in all these curves here. This is the percentage of electricity produced by clean new renewables like solar panels, like aeolic energy, like tidal energy. But while the very high human development index countries, generally the higher income countries, are leading in the adoption of renewable energies with about 11% of all their electricity from clean renewables, we are leaving low human development index countries behind, with only 2.3% of their energy coming from clean sources. And the reason why this is important is because we're widening the gap between very high human development index countries and low human development index countries, with those that are more developed, more advanced economies leading the way and leaving the lower human development index countries behind, widening the development gap. This is also hugely important for health. The energy sector is a big contributor to air pollution. So we're seeing that mortality from air pollution is still really high. We estimate about 2 million deaths every year from dirty fuel burning, both fossil fuels and biomass, and that is only from outdoor air pollution. The WHO estimates that total exposure to air pollution reaches 7 million deaths every year. And interestingly, when we look at what's happening in the household sector, here is where we see that big inequity. The poor households, those in low human development index countries, are still by and large relying on the use of biomass to meet their energy needs. Biomass being a very dirty fuel that leads to very high concentrations of air pollution inside people's homes, and that also is unreliable. So this translates to energy poverty. And energy poverty has multidimensional impacts on people's health, their capacity to access education, their capacity to access essential services. When we look at the household sector in particular, we're seeing very high levels of exposure to household air pollution, mainly because of the burning of dirty fuels. And we estimate about 140 deaths per 100,000 across 62 countries, mostly in the low and medium human development index group. This is an unacceptably high burden of disease and mortality related with energy poverty, which we could tackle by transitioning to clean fuels. So this is the cost of inaction on tackling climate change. Another sector which is very important to look at is obviously the food sector and our agricultural sector. The agricultural sector contributes to about 30% of all greenhouse gas emissions. And it's also linked obviously to our diets. So here is where we see huge co-benefits from mitigation and the untapped potential to save lives through health-centered, sensible climate action. So we're seeing that agricultural emissions are still rising. From the year 2000, they increased by roughly 22%, and that almost 60% of agricultural emissions still come from red meat and dairy production. And the flip side of that is that the excessive consumption of red meat and dairy is a leading cause of morbidity and mortality globally, the excess consumption. We estimate that about 12.2 million deaths could be saved if we were to transition to healthy, low-carbon diets. And most of those deaths, or at least the group that has the biggest burden of disease and the most death that could be saved, is the very high human development index countries, generally the most industrialized countries, where we're seeing diets that are unhealthy, too rich in excessive consumption of red meat and dairy, and poor in the consumption of nutritious plant-based foods. So here we could save 12.2 million lives by transitioning to healthy, low-carbon diets while tackling much of those 30% of greenhouse gas emissions that the food sector contributes to. So I've talked a bit about the energy sector, the food sector. There's another sector that is hugely important for this. That is our sector, the health sector. The health sector, through its activities, contributes to about 4.6% of all global greenhouse gas emissions. They also contribute, those activities, to the emissions of air pollution. We estimate about 4 million DALYs, disability-adjusted life years, annually due to health sector activities. So if we're going to deliver health through our health systems, we cannot keep on harming health through the associated air pollution and through the greenhouse gas emissions that are threatening our survival. So here we have a huge opportunity also to decarbonize our health sector, but we also have an imperative to decarbonize the health sector, not only because of the harm it generates, but also because we will have no choice. If we assume and if we understand that we need to reach net zero by mid-century, if we need to stay within 1.5, and globally we're committed to pursuing efforts to doing so, the health system needs to be part of that transition. So we need to learn how to deliver health, excellent quality of care, without harming health by emitting greenhouse gas emissions. And there's a lot of effort going on in terms of learning how to do this. But despite the huge co-benefits and the opportunities to decarbonizing the health harming sectors, our energy sector, our food sector, and to decarbonize our health system as well, we're still lagging, as I said before. Our greenhouse gas emissions are still rising, particularly from the persistent use and burning of fossil fuels. And there's very obvious reasons behind this. Our energy systems are still very dependent on fossil fuels. And what that means is that most countries will subsidize fossil fuels to make energy affordable. The cost of this to the 78% of the countries that we've analyzed rises to $305 billion in explicit fossil fuel subsidies. Countries are allocating $305 billion in net total per year to subsidizing fossil fuel subsidies, mostly using taxpayers' money. 30% of the countries that we've analyzed allocate more than 10% of their total health budget to subsidizing fossil fuels. And this is data from 2020. 2020 was the year where our health systems were on their knees because of the COVID-19 pandemic. And we were still allocating $305 billion. I want that number to stick in, to subsidizing fossil fuels. I told you I would tell you some of what's happening in this year's report. We've captured data for 2021 and a bit of 2022 as well. Because of the cost of living crisis and because of the energy crisis, obviously the price of oil and gas rocketed after the pandemic. And what we've seen is that we've reached record high levels of fossil fuel subsidies as a result. This is because countries were trying to make energy affordable. And this is because we were still so dependent on volatile fossil fuel markets that changing price and therefore with enormous burden on countries to subsidize energy, to make energy affordable and to avoid energy poverty. Subsidies that we could avoid by redirecting this funding to sustainable low carbon energy grids, to healthy energy systems, to more sustainable lifestyles. And we could save so much of the death and disease that we already spoke about. And then the other indicator, which is worth noting, is what is happening with the oil and gas sector itself. We've heard many pledges about decarbonization of the oil and gas sector. We hear often many pledges of net zero from fossil fuel giants. But in reality, when we look at their current investments that they declare, what we're seeing that they're on track to exceeding by 173% the level of greenhouse gas emissions associated with their production by 2040, more than a 1.5 degree world would allow for, 173% excess. And as you can see in this graph down here, we're seeing that they're increasing the oil and gas production plans. Since 2022 to 2023, that excess production increased by 61%. So we're not only not transitioning away from fossil fuels, we're actually actively investing in expanding our oil and gas sector even further than our 1.5 degree world would allow for. So here, when we talk about what the oil and gas sector is doing, we're talking about health harming activities that we all need to pay attention to, and that will become so important also in Baku. So just to close, the links between climate change and health are undeniable, inextricable, and the way to deliver a healthy transition, the way to deliver that 1.5 degree world could be through a health lens, the most important public health interventions of our times. We could save millions of lives a year from healthier diets, reduced air pollution, increased access to urban green spaces, healthier living. We need to strengthen our health sector, our health systems, because it's the first line of defense against the growing impacts of climate change. We're already late in adaptation, so efforts definitely need to go to protecting the most vulnerable and the most effective. We can also, from the health sector, deliver public health interventions that significantly contribute to decarbonization, for example, by promoting healthier diets, through more stringent air pollution guidelines, as the WHO has set, calling on countries to abide by those standards, and delivering healthier living, promoting active travel, promoting healthier urban environments. We from the health sector can take direct control over 4.6% of our global greenhouse gas emissions, also 10% of the GDP that we control, so the cascading effect on our economy can be huge. And obviously, we need to be at the table to help shape our decarbonization efforts to deliver those enormous co-benefits that we discussed just now. We could save millions of lives each year by doing so. So the effort is definitely worthwhile. So with that, I thank you very much for your attention. I invite you to visit lancetcountdown.org. You can explore a lot more of our assets and our data there. And I hand over back to the moderator. Thank you very much.